Dr. P.K. Hazra is a renowned interventional cardiologist based out of Kolkata who was recognized and responsible for installing the first artificial heart and wireless pacemaker in a man in Kolkata. Dr. Hazra, with his experience of nearly 33 years and interest in radial angiography, pacemaker implantation, and peripheral angiography, has acquired his knowledge and degrees from best of colleges, including Calcutta Medical College and PGI Chandigarh. His motive is to provide awareness to prevent heart disease and live a hearty and healthy life. Today, he helps us understand the concept of heart failure is no longer a life failure.
There are many heartbreaks that ultimately causes heart attack and heart failure and
yes.
death. Heartbreaking news or breaking heart syndrome can culminate into heart failure. So heart failure is manifested by having symptoms like breathlessness, getting fatigued. We can live with half of the liver. We can live with one kidney, but we cannot live with half of the heart. But heart failure, as I said, we are much more interested in heart failure because there are a lot of new developments, new therapies are available, new drugs are available, new way of treating heart failure has prolonged many people's life. Heart failure is a new entity, and you should give due importance to this entity, and many lives can be saved. It's not that devastating what it used to be in the past. Nowadays, people can lead a normal life, 30, 40 years normal life with good dose of drugs and devices.
Welcome all to this special episode where we're going to talk about heart failure is no longer life failure. This phenomenon is not new, but this is certainly new to discuss about and know more in detail what exactly is heart failure. And who better can we have to discuss about this than Dr. P.K. Hazra in Kolkata, who is an interventional cardiologist and a very renowned name, who will take us through understanding heart failure and various other aspects. Stay tuned with us to understand it in details. Thank you so much, sir, for your time
Thank you
today.
very much.
It's a pleasure to have you and understand a topic like this, which is not just close to your heart, but it is something which is going to protect many hearts today. Dr. Hazra, let's make it a little light to understand. We have known about heartbreaks. ये तो सबके experience में है. We've known about heart attacks. We've known about cardiac arrest. Now heart failure, when we say we don't understand, तो एक simple term में आप कैसे बताएंगे कि heart failure क्या होता है?
Right. So if you have asked me only heartbreaks, then it could have been socio-medical issues. There are many heartbreaks that ultimately causes heart attack and heart failure and death.
True.
And these are called Takotsubo cardiomyopathy. Like these are the mainly diseases of women, and sudden stress, anger, divorce, separations, a loss of somebody in the family causes sudden rise in their sympathetic hormones in the body, and this heartbreaking news or breaking heart syndrome can culminate into heart failure or even death.
Oh my God.
And heart attack is completely different ball game and different disease. When you have flowing arteries in human body, two things flow.
Yes.
One is blood, another is urine. So if your blood stops flowing, that means it is ultimately death. When it slows down, that means the blood is the most important fluid in our body, which carries nutrition and energy, oxygen, to the brain, to the muscle, to the kidneys, to the liver, and it sustains life. So who throws or who pumps this fluid? That is the heart. So heart failure is manifested by having symptoms like breathlessness, getting fatigued, tired, cannot lie down flat, legs are swollen, urine output is reduced, they lose weight, and it is a devastating disease sometimes.
Sir, with the symptoms you told me, It leads to breathlessness, tiredness, fatigue. These are symptoms which are very generic in the lifestyle we are living. आज किसी को भी ये symptoms दिखते हैं. We feel very tired because of aging, because of the activities we are into, stress we take. Then other fatigue thing you're saying, you feel like you're not feeling like doing much thing. So how does one realize that these symptoms are heart failure symptoms? ये बहुत people ignore it. They feel like no, breathlessness might be an asthma. Tiredness might be weakness.
In human body, if it comes suddenly, whether it is sweating, whether it is loss of consciousness, giddiness, any chest difficulty which you have never faced in your life, and breathing difficulties which came suddenly, take it for granted that it is heart. And if it is of slow onset, बहुत दिनों से हो रहा है, slowly हो रहा है, it is for months and years, then perhaps it can be anything, but you must exclude heart disease. जो fatigue, dyspnea, ये बहुत कारण से हो सकता है, but one of them is heart failure. As you have said, that even depression can cause fatigue, uneasiness, palpitations, not able to walk, not able to work, not able to concentrate, not able to sleep properly, they lose weight or gain weight. So these are one of the manifestations of heart failure. So heart failure can mimic other diseases that has to be sorted out by cardiologist, by proper examinations, by proper investigations, thorough investigations like blood test, different x-rays, ECGs, echocardiography, that can separate a heart disease, heart failure from your asthma. But as you have said, it is quite common or misunderstanding or myths in our society that these are like passing symptoms or it should be taken lightly.
Yes, it's a normal thing. So how much difference it makes, suppose I diagnose or I self-realize I've got this problem and I go to the wrong doctors, wrong specialized doctor, because we are self-diagnosing half the time. We feel like, okay, it's just cold, we will do this. So how dangerous is that for the progress of heart failure, because it might be in stages?
Right.
So
there
are we losing out
there
that
are 1, 2,
safety
3, 4 stages, and one extreme is you're healthy.
Okay.
Other extreme is death. So in between you have like mild, and that means thoda sa problem ho raha hai. And if you diagnose heart failure or any heart disease, any valuable heart disease, diabetes, hypertension, asthma, any delay in the diagnosis like cancer can cause havoc to your body. These are called end stage heart failure. So
end stage heart failure.
Last stage of cancer, last stage of kidney, when you go for dialysis. So similarly, if you reach end stage heart failure, the prognosis or the survival or the chance of good living and denying deaths almost negligible, and it is as bad as cancer.
And what are the benefits of recognizing it early? Because how soon does it progress to that?
Okay. So
let us
it is not always 1 plus 1 is equal to 2. It can be 1 plus 1 is equal to 10 sometimes. Okay. We can live with half of the liver. We can live with 1 kidney. But we cannot live with half of the heart. Yes. So heart is single organ.
Yes.
Any damage, whether it's covering, whether it is muscle, whether it's a blood supply, whether it is electricity, whether it's a valve, whether there's been blood related issues, it can cause this kind of symptoms, which is completely different from heart attack. Heart attack is basically a occluded artery, blocked artery due to smoking, diabetes, cholesterol, etc. But heart failure, as I said, we are much more interested in heart failure because there are a lot of new developments, new therapies are available, new drugs are available, new way of treating heart failure has prolonged many people's life, and it is a pandemic now. It is like many young people are getting affected. So there is a need to talk about heart failure more emphatically and with more importance of early diagnosis, preventing heart failure, no smoking, diet, stress reduction, hypertension control, and application and adoptions of newer drug.
how do we look at this awareness being helpful now that we know about heart failure, which earlier was not discussed because we are advancing in our ways of addressing to it? How do you think it is helpful now that more and more people can now stop feeling towards the end, as I understand, end stage of heart failure, you feel my life is failed, I can't do much. But now because of this awareness, we don't need to feel that it is a failure. So how positively can we look at
right
this?
now,
building?
the commonest cause of heart failure is atherosclerosis. That
Okay.
means your blocked arteries. Some people who gets heart attack or prone for heart attack, they are usually smoker, diabetic, alcoholic, and they have a family history. So this ischemic heart disease can culminate into, can lead to heart failure, heart attack. There are some diseases like in children, you have a valvular heart disease. That means your valves are bad or infected. In between you have pregnancy, hypertension, kidney disease, atrial fibrillations, leaking valves. Those are there. Second part is the young youths,
Yes.
drug addictions,
Yes.
energy drinking, gutkhas, and many energy boosters
Yes.
like
Steroids.
steroids and muscle building
Yes.
thing. These are dangerous,
Okay.
and these cannabis can affect and can kill the young hearts. I mean, we have seen people suffering from heart attack at the age of 18. So who are these people? These are the people who indulges in addictions. Look, smoking is not that bad, but these drug and abuse of substances are dangerous.
Okay.
They will not give you chance. So smoking is definitely bad from early age, but some people fall into prey of wrong association during our school days or college days. But there is always a chance to quit.
Yes.
And those people who have a heart disease in the family, those people whose parents have undergone angioplasty, bypass, they should be more careful. Now, you know, the KK died suddenly.
Yes.
Whether the KK's death can be prevented or not. So KK's story unfolded many things in youth. So these are called sudden cardiac death. The sudden cardiac death, to large extent, can be prevented by social awareness, by a program like this. Now, how do you know that you are prone for heart disease? Regular health checkup.
Yes.
Stopping vigorous exercise.
Yes.
That means you marathoner doesn't mean that you live long. So weightlifting of too much,
Yes.
lack of sleep, stress, etc. Plus checking your cholesterol and taking cholesterol lowering drug very early in the age. Anti-diabetic
Thyroid,
drug,
yes.
thyroid disorders, and bringing down your hypertension with a good dose to a lower target. And knowing your genes, like you have now, many genetic tests
Yes.
are available, and these polygenic risk scoring can tell us that many of these diseases are inherited.
So in simple language, are you saying when you have these symptoms of overweight or diabetics or genetic issues that you figure out, you should also go for knowing your heart failure status
Right.
or
So-
diagnosing?
Who are the people who are really ask for the help?
Yes.
Not at the age of 15, 16, because of the growing children, until unless, because it usually does not affect this age group.
At the age group.
So who are these people? Those who are like completed their studies, working, and maybe 30, 40s, they should go for regular health checkup. There are a lot of newer developments like CT scan, treadmill test, ECG, echo, genetic testing, cholesterol level, your uric acid level, your hypertension, your genetic code, now your different body fat. Overall, it is a holistic approach of obesity, stress, and these are all, I'm saying, it's preventable to large extent.
So from prevention, we go from diagnosis. Now we want to understand, once you have diagnosed some symptoms in you, what is the process? I want to know it from any story that you might have encountered, anything, any case that you've come across in your life where you were just amazed at what status the patient came in, did not know about it, and now he got out of it.
Okay, I can tell you one story of a young lady working in as a school teacher, husband working as a software engineer. And now this lady presented with a very a bad heart after delivering a baby.
Okay.
So as I said, this is pregnancy-induced cardiomyopathy and peripartum cardiomyopathy we call it. And she came in a shock stage. Then she was given ECMO support, life support. ECMO, became very popular during our COVID days. It can support lung, heart, and circulation. And then she remained on ECMO for quite some time, and ultimately, slowly, she recovered. But nowadays, when she got better on ECMO, then her ejection fraction got improved. She started recovering, infection got better. Now she is coming back with almost normal ejection fractions with 4 or 5 drugs, and she's a working lady. So there are different stories that heart failure is not one-way traffic. He died because lack of organ donations or facilities. So he could not manage a organ. So these are the stories like young people, everybody wants to live long. Now, if you have heart disease, it's not a lost hope anymore. You can start thinking positively. But, if you develop heart failure, you have another 40, 50 years to live. But if you develop heart failure at the age of 80 years,
Yes.
definitely you're not going to live another 30, 40 years. So young heart failure is a really concern because they are in the productive age, male, female. They maybe just got married, they have own children, so they have social responsibility, a family responsibility, which can prevent deaths or prolong life.
Or
Definitely
give
medicine.
hope that now
There
that
is
we
a
know
hope. There is a
about
lot
it-
of hope now.
Yes.
Because but all these are very costly hopes.
Yes.
I mean, costly drugs, costly device. One artificial heart can cost you about ₹1 crore in my hospital. One special pacemaker can cost 50 lakhs.
Yes.
And one transplant, the first cost, second cost, the medicine cost, the biopsy cost, almost ₹1 crore. So many people cannot afford it. There is a hope. Those who are having heart disease at young age. So we are focusing more on prevention, drug modification, and applying these drugs which are affordable to many, and then vaccines and other things will come. Next is your terminal therapy. So these are transplant, LVAD, clips, pacemaker are terminal care.
Let's take a case as you shared some of the anecdotes with me. If there's a youngster who's realizing and diagnosing and understanding, okay, I might be in the stage of heart failure, and then he has no other big disease, how much can he come out of that? How much, because of the awareness that there is something called heart failure, which we never spoke about. So how much is it possible to come out of this stage of heart failure and live a healthy life, feel good?
It comes as a shock, comes as a surprise, not only to the patient, to the colleagues or the
Yes.
wife, the children, and if he's married. Now, those who have suffered this disease, they must be listening to me, and they can relate their story with my narratives. That it is not many people who get affected at young age, 20,
Okay.
30. That is encouraging. The heart failure usually middle-aged.
Okay.
People who are hypertensive, those who had heart attack, they are the people who suffers most.
Yes.
Now, without any blockage in the heart, you can develop cardiomyopathy
Okay.
or muscle disease, which can
Okay.
cause heart failure. So it can affect any age, but sometimes it comes with a warning. Sometimes it comes with a genetic background. Sometimes it comes all of a sudden without any warning and without any identifiable cause.
Suppose we see someone go through a heart attack and then realize, okay, I'm having a symptom of heart failure after heart attack, because that might be symptomatic to your heart not being so strong. So how preventive it is at that stage, that diagnosis is a positive light that, okay, now you realized you've not stopped at heart attack and let it be.
Okay, so you have to go to a good doctor.
Okay.
And there
Mr.
are
Hazra then.
no, I mean there are a lot of good people who can treat heart failure. So these are called heart failure clinics,
Okay.
heart failure specialists.
Yes.
and these are a special care and special group of doctors who offers the modern therapies, who gives a positive thought process
Yes.
to work out these problems from the mind, and also future planning, follow up. There are a lot of wearable devices and self monitoring tools. You don't have to come to a doctor anymore.
Okay.
So you remain connected through the iCloud with these gadgets. Any change of your symptoms, the good or bad, you can communicate.
So now talking about heart attack, or can we say all heart attack cases lead to heart failure, or then the progress to go there? Do we look at this also in a simple?
Look, ultimately, if your heart is weak after a heart attack or blocked artery, whether you have angioplasty done or bypass surgery done, ultimately some amount of heart failure will happen.
Okay.
It all depends on the time span. Now, if you are on good medicine, you may not land into a telltale diagnosis or complete diagnosis of heart failure.
Okay.
So, heart attack or ischemic heart disease is one of the leading cause, main cause of heart failure. So, you can have heart failure without having heart attack. You can have heart failure, all the heart failure patient can live without having a single coronary artery disease block in their life. But some of these heart attacks can cause immediate heart failure. That means your muscle has become so damaged, so poor in contractile function, pumping functions, that they are not able to maintain a systolic blood pressure of 100 or 90, which is sufficient to maintain the cardiac output or oxygenation for different parts of the body. So these young people, they should not lose hopes, because if they adopt a good lifestyle, if their cholesterol comes down to almost zero,
Yes.
if they do not indulge in wrong habits, if they go for regular exercise, early health checkup, and there are many drugs which can prevent the progressions of heart disease.
Failure. Okay.
Heart
disease.
failure.
Okay.
So progressions means the diseases can be reversed now by new therapy. These are all injectables now. It's not
Yes.
statin or cholesterol lowering drug. We can reduce cholesterol to as low as single digit, 5, 6, 7, 8, 9, 10 by giving some injections, which are MAPs we call, twice in a year. I can't take the name, but these are available now. Now there are also new development like hypertension. We can do angioplasty of the kidneys.
Yes.
These are called renal denervations. So one time angioplasty of our kidney by radiofrequency ablations can give a 10 years drug-free treatment. Now there are newer hypertensive injections. So you take one injection, don't have to take medicine. Zilebesiran, this is a chemical name, medical name, published in New England Journal of Medicine. And if you take this drug once in a month, you don't have to take pills. So these are the newer things. Pollution, sound pollutions, air pollutions, also causing lot of havocs in having heart disease at young age, diabetes, as I said, food habits, as I said, high salt intake. We don't have much of like walking space or physical exercise space, morning walk space in our city, in our country. So those villagers, those who do manual labor, those who are doing good amount of physical exercise every day, they are not spared because they smoke.
Oh, so it's
So
like we have a better
countered,
lifestyle
yeah,
and
in better lifestyle,
ecosystem,
but they smoke,
you have
they
taken
take
to an
bidis,
addiction,
addictions. So what good you achieve after having good manual labor, you can lose the same benefit by having a smoking habit. You must have
So
seen a
there's
lot
no
of,
good world to go and find.
so they are also prone. And because of poverty, though our country has progressed so much in terms of economic growth and development, access, different health scheme of government of West Bengal, Indian government has offered, we are actually seeing a better advancement or better treatment facilities and good facilities, many government colleges which are not there in the past. As I said, in the past, we used to treat heart failure by sucking blood by leeches
Yes.
and making a wound so that your blood flows out your body. You sit down and you're tied to the bed. You cannot move.
Oh
you
my
cannot.
God. That was not a treatment, but a
this is not a
torture.
treatment. And since it is not long ago, so many presidents of America, many prime ministers of many different countries, Churchill, Stalin, Roosevelt, they suffer from hypertension and stroke. Even the many new presidents, I mean, they are still living. They had heart attack, and they are living with heart failure. But these celebrities, or it is not a disease of celebrities or presidents or prime minister anymore.
It's
It
a
can
very-
affect
it's a common man
as a
disease
common man's
today.
disease, basically.
So, understanding from this, when you mention about medicines, just to understand, there are specific medicine just to deal with heart failures. So, if you're talking about asthma or any particular, are they directly linked to?
Look, these are called ARNIs. I cannot take any specific name for any particular drug. So, what are these? They were there, but those medicines were not effective in reducing death, hospitalizations, and they were prone for side effects.
Okay.
Many of them are now anti-diabetic drugs.
Okay.
So we are not interested in talking about these diabetic drugs in the treatment of heart failure. But when you came to know these drugs, though they are anti-diabetic, but they work as anti-heart failure drug even in non-diabetic. So these two drugs has changed the whole paradigm of treating heart failure. So ARNI, there are a lot of newer Indian brands, and India is basically producing high quality pharmaceutical products,
Yes.
and it is exporting
Yes, to US.
any corner of the globe you go, you get Indians
Indian
and Indian
manufacturing.
pharmaceutical manufacturing products.
Yes.
So this is a breakthrough because of the present government's attitude, and they're thinking about the poor. Now these Indian or made in India products are affordable, attractive,
Yes.
available solutions to thousands and millions of Indians.
Yes.
That has created a huge change in the perspective of treating heart failure and treating many non-affordable community with these drugs, and these are available on the government stores.
So, coming to myths, I want to understand. We started with this idea of myths and misunderstanding on the concept of heart failure. So, tell me some incidents
Okay,
where
so
you were
myths-
shocked about the myth. कोई story है कि किसी ने बोला और आप शॉक हो गए कि इस तरह का भी understanding लोगों में है?
There are a lot of myths that some people they think it is asthma.
Yes.
Asthma means they take puffs many years and they never
They start taking pumps for many years and they don't know that it is a heart failure.
Yeah. They sit at home. They said, okay, I can't walk. I take puff. I feel little better. But when they came to know that his or her pumping is very low, and once you change their inhalers to heart failure drug,
Yes.
they feel so good. I mean, within 7 days or 10 days, and they regret of going to wrong doctors and lack of awareness. Then the second myth, as you have said, that heart attack is equal to heart failure, or brain stroke is equal to
Yes.
heart attack or stroke. So stroke is basically a brain stroke, like it affects your brain, get paralyzed, you lose your speech, you're not able to walk, paralysis. But heart stroke or heat stroke is completely different. Heat stroke, heart stroke. So stroke means is it coming all of a sudden to major organs affecting you? Then it comes as a stroke,
Okay.
a lightning stroke, something
Okay.
like that. But heart attack is equivalent to common terms like myocardial infarctions in the medical literature, but heart attack is equal to blockage of the flowing coronary arteries, either all three or one of the arteries.
But cardiac arrest is a sudden shock.
Cardiac arrest is complete stoppage of the heart function, either electrical
Yes.
or pumping function.
So now we can understand that all these are small, you can say, hurdle progressing to the street of heart failure.
Yes. So heart failure, ultimately everybody will die due to stoppage of your pumping and the
Yes.
stoppage of your electricity. So that is ultimate.
So now understanding, now that we have got so much clarity about different ways, I didn't know heart is so complicated. That's why heartbreak causes so much pain. But coming to understanding in the holistic way, now when we are able to get to preventive level, diagnostic level for heart failure, now people also realizing, okay, I'm having these symptoms, it might be heart failure. So are we in a stage that people can clearly say that heart failure is no longer life failure because we can diagnose, or we can be aware, or we can prevent, or at any stage we can address it?
Heart failure people cannot go for rigorous sports or marathon or football.
Okay.
That's prohibitive.
Okay.
And there are definite restrictions in life. You cannot do that. But after angioplasty or bypass, people can do jogging, walking, cycling, but not marathon, not football sports or
But the
body
basic quality of life
yes,
can
quality
be
will
there.
maintain. But in heart failure, we advise them to take rest,
Okay.
not bed rest, but not too much of physical.
Take life
exercise.
easy.
Take your life easy. Relax, no stress. Whatever stress you had in the
But
past.
isn't that the best way to live life? Why to
This
take
is
any
the
stress?
best way of living life. But if you do not aim high in your life, or if you are a moron, you don't have any stress. A moron cannot become a successful story in the real world because he doesn't have any stress. So stress brings purity, stress brings quality and success in your life. So without stress, you cannot perform. If you are stressless, the certain amount of stress is definitely helps you to give more productive things to the society professionally. And but undue stress or too much of stress is
Over
definitely
anything.
over stress is definitely bad.
So if at an early stage heart failure is diagnosed, is that going to be a stage where we can say yes, we have a better quality of life waiting for us because the benefit of diagnosing early is going to help us?
Yeah, there are two way of thinking life. One is life to your years, life to your years, and years to your life. That means years to your life means you live longer,
Yeah.
and life to your years means good quality of life,
Bigger life.
bigger
Zindagi
life,
badi
enjoyable.
honi chahiye,
Yeah,
lambi.
मजे में रहो.
Yeah.
So both are important. Not only quality, also quantity. Not only quantity, also quality. In both ways. Some people, like for young people, it is both quantity and quality.
Yes.
For elderly people, 80 years, it is quality of life. It is
Because
not the
there's
quantity.
The
Because
quantity is done with.
quantity is done with. He has lived enough. So it all depends on the perspective and what age you are intervening. But as a whole, every life is important. Everyone is dear and near to their family members,
Yes.
their grandpa, grandma. They want to see their grandpa, grandma living forever. So our duty is to prolong life, take away the pain and sufferings of any disease, whether it is cancer, heart attack. Everybody will die. Everybody has the right to live, but ultimately everybody has to die. But how you die, and can you die without pain, without suffering to yourself and to the society, to the economics, to the country? So don't become a burden to the society, burden to your family members. And these are the drugs which can reduce the burden of heart failure, burden of heart disease, economic burden, and many things can be done with the help of pharmacotherapy.
So we kind of understand this, that with the awareness that we are creating and we are understanding this whole idea, the quality of life can be improved.
Yes,
Because
to large extent.
Because without knowing about heart failure, we were anyway living somehow.
It has happened since 2015 onwards.
How?
Before 2015, there were no such beautiful drugs, as I said, ARNI or SGLT2 inhibitors. These are the two drugs which has changed completely the way we used to treat heart failure in the past. So I was born in 1965, did my medical schooling in 1987. That time, hardly two drugs were available for the treatment of heart failure. Now we have plethora of drugs, and these are very safe drugs. Those two drugs are full of side effects, and people could die due to those two drugs. Now people will live longer, and these are basically drugs without any major side effects, and these are easily tolerable, affordable, attractive and available.
What are the 5 straight benefits that you tell? Now we are going very fast on a rapid question to know 5 important benefits of knowing about heart failure for a good life.
Okay, for heart failure, as I said, it's not only water logging anymore. It is free of symptom-free life, a longer life, good quality of life, less side effects of the medicines, and stay away from this costly device, the transplant.
Yes.
So these are the 5 things you should aim initially for all heart failure.
Okay. So these are the benefit one gets through
Yeah.
recognizing it. So what are the quick tips from your end you would give to the youngsters or the group you are catering to, 30s to 40s, for having a change of lifestyle? Because change of lifestyle is again it changes with your state of mind, and as you grow, you go ambitious to you go content, and then you go to achieving. So what are the tips you give for change of
I think
lifestyle?
first of all will be healthy life, social life. Not stay young, but your mind should also be staying young, not
Yes.
only physically doing exercise. Number 1, stress. Number 2, I feel that all the problem starts from cholesterol.
Okay.
So if you can bring down your cholesterol to a safe level for longer period of time, so this kind of investment, you deposit your money in the bank, longer you invest, for many years you get the best of money at the end of 30 years, 40 years return. So investment of lipid lowering, if you start early, hit early with your newer drugs, these are very safe drugs, lipid lowering or cholesterol lowering drugs. And third will be physical exercise.
Yes.
Fourth will be regular health checkup.
Okay.
Last will be some vaccinations for influenza, pneumonia, herpes. These are these COVID vaccines, and many non-invasive tests like CT scan, ECG,
Yes.
echo. If you are having a risk in the family, running in the family, having somebody in the family died, has undergone bypass, so these are the people should be more careful.
And sir, talking about, because you spoke about cholesterol and even health, weight, what are the 5 important diet tips you give to prevent from heart failure?
Okay, so diet, now we know that not that important for cholesterol, like vegetarian,
Yes.
non-vegetarian, both get heart attack. But as far as the diabetes is concerned, raw sugar,
Okay.
high salt intake, fruits and vegetables, avoiding butter and fatty food, and don't go for this protein magic or kind of muscle boosting replacement, nutritional replacement. That's dangerous. So this nutritional replacement of losing weight or building your muscle can cause sudden cardiac death.
Okay.
That should be avoided. You have to investigate, you have to give hopes, you have to sell hopes, you have to show hopes. And there are a lot of hopes in medical therapy of heart failure
And so
as device therapy.
one more story of a diagnosis, like you told me, that had gone wrong, and because of heart failure knowledge, they could come back to the right treatment. Has there been such
Yeah,
a
there are many stories like the holes in the heart in children, the rheumatic valve, that asthmatic stories. So another story, as I said, very senior physicians, and he was taking these inhalers, etc. And basically he is having left main or 3 arteries blocked,
Okay.
very critical blocks, and he was thinking it is just age, and due to he was a smoker and he had asthma in the past, so he was thinking it is acute exacerbation of the asthma or COPD. So he was increasing his inhaler dose, but more he takes, more he gets symptoms, because these inhalers are not safe, because they can raise your heart,
Yes.
blood pressure, heart rate. So he came down, then he did one angiography, CT scan angiography. That CT angiography showed that he has got very critical arterial blockage. So these new things can be an alternative to surgical bypass in many patients who can have relief of their heart failure symptoms by opening their arteries by angioplasty and stent. So many of these ischemic heart disease, blocked or clogged arteries, can manifest as heart failure. They are misdiagnosed or diagnosed very lately or wrongly diagnosed.
Yes.
So you need to have a proper investigations before declaring that you don't have a heart disease, don't have a heart failure.
Is there education and awareness required in physician, doctors,
Definitely
and
it is
specialists?
required, like anemia. many people, especially in women, if you have anemia, they are not treated properly.
Yes.
And they tell the patient that, look, you are having anemia, you don't have any heart disease. But it's better to investigate these women who has anemia, treat anemia. But in spite of treating the anemia, if you do not get any relief of symptoms, that means you're missing something. It could be heart failure. It could be the swelling or breathlessness could be due to heart failure. So what are the things you can do? Some blood tests, ECG, echocardiography, and examination, proper examination by cardiologist or heart failure specialist. So there are definitely a role of physician, good physicians, and patients are never wrong. One thing in life, in last 30 years of practice in cardiology, I've realized patients are never wrong. Doctors may be wrong, but patients are never wrong. They don't come to a doctor just because of fun, and they come for some symptom. If they feel bad, then only they come. So if they come, it is our duty to diagnose them that you are having something or not having something. So awareness, examinations, proper attention, sympathy, empathy, and adoptions of newer technology, newer drugs, knowing about the drugs, giving them a hope, telling them a positive story, a good narratives of good life, good quality of life, prolongation of life, less pain, less suffering, less burden to the society, all can be possible only with one thought, that heart failure is a new entity and you should give due importance to this entity, and many lives can be saved by having this kind of conversation with the patient.
So you can say heart failure is no longer a life failure?
No. It's no longer a failure of life or life failure. It is not that devastating what it used to be in the past. Nowadays, people can lead a normal life, 30, 40 years normal life with good dose of drugs and devices.
So what is the secret of your strong heart? How is
I do not know whether how long I will live, but definitely I take cholesterol lowering medicine, though I do not have any hypertensions. And my parents probably has given me a good gene, and nobody in my family died due to heart disease as such. My brothers are hypertensive, but yet not hypertensive, less salt intake, and I do not use rickshaws, or I do some kind of regular exercise. Don't take lift in the hospital. I just take the staircase. I walk. I think positive, and I lead a good life.
So did it happen over time, or this was
It is there for so many years. I mean, it is decades.
So now you need to tell the youngsters how to shift their life, because they are not going to do it because of the fear of heart failure alone.
If you are a smoker, you have to cut smoking and the number of sticks you take in a day. If you are alcoholic, you have to reduce or stop.
Yeah.
If you are taking gutkhas, etc., I'm not saying that youngsters should stop taking all vices.
They should start living like you.
Yeah, once in a year, once in a blue moon, okay, fine. But it should not indulge in the binge drinking, binge eating, binge smoking, binge physical exercise, and binge enjoyment. Like it should be slow, steady. You do every day to some extent, but do not forget to look after your own health. But ultimately, it is you who is going to suffer,
Yes.
not your parents. So you have to take care of your health. As long as you take care of your health by your own, and you go for this kind of preventive measures, definitely you are going to live long.
So life pleasures are less important than life safety.
Yeah, safety is definitely more important than the pleasure. Pleasure is also important at young age. I'm not saying that live like sadhus. Sadhus also die. They also die
Because of heart failure?
heart failure and diabetes. They are not spared, because you are seeing sadhus, those who are living. They are not seeing sadhus who are not living. So you cannot say that all sadhus are living longer. Many sadhus also died due to these ganja smoking and
So they have
alcohol
addiction.
addictions. They have also addictions. There are some type of sadhus. They different. I am not going to that controversy, but they are not God.
Yes.
So everybody will die. But try to think that I live longer with a positive thought that these diseases are there. Unfortunately, the God has given to me, but there are a lot of hope still left if you adopt this kind of medicines, device and drugs. Dil ko majboot rakhna, you have to listen to good music and good movies, humor, and good physical relationship with your partner, and go for outing, go for travel, sightseeing, pleasurable moments, and laughter is the best medicine for your heart failure or anything. So try to laugh. जिंदगी मिलेगा नहीं दोबारा. तो अभी जो है वो enjoy your life what you have today, and tomorrow is just another day in your life. So don't bother about tomorrow's today. Live your today properly, and definitely plan something for future and tomorrow, but don't waste your today.
It was true what you said today. Thank you so much, Dr. Hazra, for taking us through in a beautiful way. More than technical, I think it was more personal. And thank you so much for your time.